Hi, this is Dr. Meghan Davis. I direct the Johns Hopkins Poe Total Worker Health Center in Mental Health, and I'd like to talk about the National Institute of Occupational Safety and Health's instrument that is used for well-being assessment. It's called the NIOSH WellBQ. When we think about how we measure well-being of workers, we tend to think of this in two dimensions. The first is subjective, what our perceptions are, what the beliefs are. And the other is objective, what the working conditions are or standards. People in industrial hygiene may be more familiar with objective approaches to measurement, thinking about physical safety or different resources or aspects of the built environment. But subjective is also important, the way workers might perceive the quality of their working life, what the various psychosocial or social aspects of work might be, can really inform outcomes like job satisfaction and can influence important enterprise outcomes like presenteeism, absenteeism, and turnover. We think about how you would measure well-being in a more objective way, right? This is not measuring a chemical. This is thinking about the built environment and the aspects of the built environment that can influence well-being. We might want to think about whether workers have fulfillment of the conditions needed for them to thrive. We might also think about things like financial security. And importantly, as we measure well-being, we want to think about how these perceptions, these subjective dimensions, relate to these more objective dimensions and how together that can influence worker well-being. There are a number of different well-being frameworks. And so the NIOSH WellBQ is part of a group of frameworks that people have used in various areas, not always at work. So, for example, the Gallup Healthways Wellbeing Index, the Canadian Index of Wellbeing, and the European Social Survey have been used on broader societal levels to think about well-being among people in a certain country or across the globe. Within the workplace, though, we think about the NIOSH Worker Wellbeing Questionnaire, the WellBQ, as being situated within the framework that it developed that focuses on 5 different dimensions: work evaluation and experience, workplace policies and culture, the physical environment, the safety and the safety climate of the workplace, the worker's own health status, and then this dynamic among home, community, society, and the workplace, illustrated in the figure shown here. So the NIOSH Wellbeing Framework was developed through kind of 2 different dimensions. One was an extensive literature review looking at what had already been done in well-being at the workplace. And then NIOSH convened an expert panel in 2015-2016 that comprised people with experience in general workplace or worker well-being assessment, people who did traditional occupational safety and health, those who were familiar with workplace policies and benefits, those in the subfield of occupational health psychology, and those who looked at integration of work and community. And so I just have here some of the domain examples and constructs that came out of these conversations in the lit review. For example, with the workplace physical environment, this included safety conditions or workplace design, and how people might perceive the safety climate, or what you could measure of the environmental conditions. Within workplace policies and culture, this could include salary and benefits, and so you might measure that in terms of what benefits are available, what types of benefits are available, how satisfied are workers with these benefits. The NIOSH WellBQ instrument is a survey. It has questions, and these questions, for the most part, come either verbatim or with adaptation from existing sources. And in fact, there were 27 different sources that were the origin point for some of the questions that are in the NIOSH WellBQ. The sources, at least some of them, examples and their references are shown in the table. These include the CDC Quality of Work-Life Questionnaire, a number of different employment surveys, a job demands questionnaire, a psychosocial questionnaire, and a work engagement questionnaire. Where there were not existing questions that fit the dimensions that were identified by the lit review and expert group as being suitable, there were new questions that were created. And then there was an extensive process of pilot testing and validation, ultimately enrolling almost 1,000 participants, where this particular instrument underwent cognitive testing, pilot testing, psychometric analysis, factor analysis, and ultimately this informed the streamlining of the instrument and elimination of less productive items. And so the NIOSH WellBeQ instrument has 68 items across 5 dimensions. It typically takes workers about 15 minutes to complete, and then there are additional optional items regarding work circumstances and worker demographics. And these are recommended to be placed at the end after the core survey is administered. It's currently available in English or Spanish, and some example questions and coding are shown in the image on the right. So you can see that one of the questions is about job satisfaction. And so someone might answer, overall, I am. And there's a Likert scale from not at all satisfied to very satisfied with my job. And each of the items has additional content available from NIOSH on how scoring might take place within certain dimensions. NIOSH recommends these to be used in a limited set of circumstances, since it is relatively new. It was released in 2021 and will probably need a decade or more of use in order to continue to optimize it. But some of the current recommended uses are to set benchmarks internal to an organization or workforce. Others are to examine changes over time or assess the impact of interventions. So, for example, a workplace policy or another kind of intervention like a modification of a champion program or addition of more employee assistance programs. And then another use is to compare results between groups within the same facility or workforce or potentially across organizations or working populations.